Hey, I'm Dr. Alara Hayes, and today we're going to go through some of the most important questions women have about their bodies, especially one of the topics so many people worry about in silence: vaginal discharge. I want to talk to you the way I talk to my patients when the exam room door closes, when the nervous laugh fades, and when that look comes across your face that says, "I've been scared to ask this for a long time." Because the truth is, you are not strange for wondering about this. You are not dirty. You are not dramatic. You are not the only person standing in front of the mirror looking at your underwear, wondering if what you're seeing is normal or if your body is trying to tell you something is wrong. I have cared for teenagers who thought discharge meant they had an infection every month, young women who were too embarrassed to tell anyone they had soaked through liners for years, mothers who whispered their questions after childbirth as if they were confessing something shameful, and women in midlife who were certain their bodies had suddenly betrayed them. So before we go any further, I need you to hear me clearly. Your body is not a mystery designed to humiliate you. It is a living, intelligent, changing system, and discharge is often one of the ways it speaks. A lot of fear starts because nobody explains what discharge actually is. So let's make it simple. Your vagina is made of mucous membrane tissue, much like the inside of your mouth. Healthy tissue creates moisture. Your cervix also produces fluid. Those fluids mix with normal cells your body sheds and the healthy bacteria that live in the vagina, and together that becomes discharge. In other words, discharge is not automatically a sign of disease. Very often, it is a sign that your body is doing exactly what it was designed to do: protect itself, clean itself, and maintain balance. I cannot tell you how many times I have sat across from a patient who lowered her voice and said, "I thought it meant I wasn't clean," and every single time I tell her the same thing. A healthy vagina is not supposed to be dry like paper, and it does not need to be scrubbed into submission. It is self-maintaining. It is responsive. It is alive. That brings us to one of the first questions women always ask me: how much is normal? And the honest answer is that normal has range. Most healthy vaginas produce somewhere around 1 to 4 milliliters of discharge in a day, but numbers alone do not always help because nobody walks around measuring what shows up in their underwear. What matters more is this: some days you may notice only a light dampness, and some days you may feel like you need a liner because there is clearly more. Both can be normal. I once cared for a college student who came in terrified because she thought she was leaking every day. She had no itching, no burning, no bad odor, no pelvic pain, and no risk factors for infection. What she had was a completely healthy amount of discharge and years of silence that made her believe normal body function had to be hidden. The relief on her face when she realized she was healthy was the kind of relief I wish every woman could feel sooner. The next question is usually about color, and this is where confusion starts to turn into fear. Because you see something milky one day, clear the next, creamier later in the week, maybe even slightly yellow when it dries, and suddenly your mind starts racing. So let me ground you. Normal discharge can be clear, cloudy, white, off-white, creamy, watery, or stretchy like egg white. Sometimes it looks almost lotion-like. Sometimes it feels thin and slippery. Sometimes it looks thicker. Those changes often reflect hormones, especially where you are in your cycle. Around ovulation, discharge often becomes clearer, wetter, and stretchier because your body is responding to rising estrogen. That fluid can help sperm move more easily, which is part of normal reproductive physiology. Before or after your period, you may notice discharge mixed with a little old blood, and that can make it look brown. A little brown discharge is often just spotting or the last bit of menstrual blood leaving the body. I have seen patients panic over that, convinced something dangerous was happening, when in many cases it was simply the body finishing a cycle. But I also want to be honest with you, because reassurance is only meaningful when it makes room for truth. Not every change should be ignored. There are times when discharge is your body's early warning sign, and this is why paying attention matters. If your discharge becomes thick and clumpy like cottage cheese, especially with intense itching, redness, soreness, or burning, I start thinking about a yeast infection. If it becomes thin and gray, especially with a strong fishy odor, I worry about bacterial vaginosis. If it turns bright yellow or green, especially if you also have pelvic discomfort, irritation, pain with urination, bleeding after sex, or a new sexual partner, then sexually transmitted infections become part of the conversation. And I need to say something that matters deeply. Needing testing does not mean you are dirty, reckless, or deserving of shame. It means you are human. Your body deserves care, and catching a problem early is an act of respect, not disgrace. I remember a young woman who sat in my clinic gripping the edge of the exam table so hard her knuckles turned white. She said, "I knew something was wrong, but I kept telling myself I was overreacting." She had greenish discharge, pelvic pain, and fear written all over her face. What she needed that day was not judgment. She needed calm, accurate care. We examined her, tested her, treated her, and most importantly, we interrupted the spiral of shame that had kept her waiting. Another patient, older and recently divorced, came in because of a sudden odor and gray discharge. She was so embarrassed she almost canceled the appointment. What she had was bacterial vaginosis, something common and treatable, not a moral failing. I want you to hear these stories for one reason. The longer women are taught to feel ashamed of normal and abnormal vaginal symptoms alike, the longer they wait in fear. Fear delays care, shame delays care, silence delays care, and you deserve better than that. Another question I hear all the time is, why does discharge change so much from day to day? Because your body changes from day to day. Hormones shift. Estrogen rises and falls. Your cycle moves. Sexual activity can affect discharge. Pregnancy can affect it. Stress can affect the way you notice it, even if stress itself is not directly causing a dramatic change. Birth control can change it. Certain medications can change it. Vaginal products, soaps, scented washes, lubricants, and even the irritation caused by trying too hard to feel fresh can disrupt your natural balance. One of the most painful ironies in women's health is how many problems begin with the pressure to be perfectly clean. I have treated women whose irritation started after douching, after using perfumed products, after trying one more wipe, one more wash, one more product that promised confidence but delivered inflammation. The vagina does not need to smell like flowers to be healthy. It needs balance. And often, the most loving thing you can do for it is stop trying to erase every sign that it is alive. Then there is the question beneath all the other questions: when should you actually come in? When is it time to stop watching and start making the appointment? If your discharge changes color dramatically, if it develops a strong or foul odor, if you have itching, burning, swelling, pelvic pain, pain during sex, fever, bleeding that is unusual for you, sores, or burning when you urinate, that is the moment to be evaluated. If you have a new sexual partner and something suddenly feels off, come in. If you are pregnant and notice a major change, come in. If you feel like fluid is leaking constantly and you are not sure what it is, come in. If something is new, persistent, worsening, or simply unsettling enough that it is taking over your thoughts, come in. I would much rather reassure you after an exam than have you sit at home afraid. I say that as a physician, but also as a woman who understands what it feels like to live in a body that changes and to wonder whether the change means danger. And I want to pause here because this is the part where so many women feel the emotion rise in their throat, the confusion of not knowing, the fear of being wrong, the embarrassment of needing help with something intimate, the loneliness of thinking everyone else understands their body better than they do. In exam rooms, I have watched women apologize before speaking. This is probably silly. I know this is gross. I should know this by now. And every time I want to reach across that distance and say, no, this is not silly, this is not gross, and you are not behind. You are living in a world that has often handed women fragments instead of facts, shame instead of language, jokes instead of education. So if you are listening to this and realizing how many years you spent confused by your own body, I do not want your next feeling to be guilt. I want it to be relief, because now you know more. Now you can notice patterns. Now you can tell the difference between what is usually healthy and what deserves attention. Now you have words for what used to feel like private panic. There is also something deeply important I want you to remember. Normal for you may not look exactly like normal for someone else. Some women naturally have more discharge, some have less, some notice obvious changes around ovulation, some barely notice any, some go through phases where hormones, postpartum recovery, perimenopause, or contraception change what is typical for them. The goal is not to compare yourself to another woman's body. The goal is to learn your baseline, learn your rhythm, learn what your body usually does when it is well. That way, when something truly shifts, you can recognize it earlier and respond with confidence instead of panic. Sometimes discharge is also affected by life stages in ways nobody prepares you for. During pregnancy, many women notice more discharge because blood flow increases and hormones change. It can be heavier, thinner, or simply more constant than usual, and that alone does not always mean something is wrong. After birth, while the body is healing, bleeding and discharge can change week by week. In perimenopause and menopause, lower estrogen can mean less moisture, more dryness, irritation, or a different texture than you remember from earlier years. I have had patients look at me with tears in their eyes and say, I don't recognize my own body anymore. And that feeling deserves tenderness. Your body is not failing because it changes with age, pregnancy, recovery, or hormone shifts. It is adapting. The important thing is to notice when changes fit the season you are in and when they come with warning signs like pain, odor, itching, bleeding after intercourse, or symptoms that keep returning. Recurrent problems deserve real evaluation because sometimes what seems like just discharge may be linked to irritation, infection, hormone changes, skin conditions, or a treatment that simply needs to be adjusted. You do not have to diagnose yourself perfectly before you ask for help. I have seen pregnant patients frightened by perfectly normal increased discharge, postpartum mothers ashamed to mention odor that turned out to be an infection needing treatment, and menopausal women relieved to learn that dryness and irritation were connected to hormones, not personal failure or poor hygiene in any way whatsoever. Over the years, I have met women who carried unnecessary fear for decades because no one had ever sat down and explained this with kindness. A grandmother once told me after a long conversation in clinic, I wish someone had said this to me when I was 14. That sentence has stayed with me because it holds so much grief and so much hope. Grief for the years women lose to silence. Hope for the moment knowledge finally reaches them. Maybe you are 14. Maybe you are 28. Maybe you are 56 and still discovering things no one taught you. It is not too late for understanding to change the way you live in your body. So if you remember nothing else from what I say today, remember this. Discharge is often normal. It is one of the many ways your body maintains itself. It can be white, off-white, clear, creamy, watery, or stretchy. It can change with your cycle. A small amount of brown can happen with spotting or around a period. But if the discharge becomes strongly odorous, intensely itchy, painful, gray, bright yellow, green, thick, and clumpy with irritation, or otherwise very different from your usual pattern, that is not something to dismiss. That is your cue to pay attention and get checked, not because you should panic, but because your body deserves thoughtful care. And maybe the most healing truth of all is this: your body is not trying to betray you. Even when something is wrong, your body is still communicating. Symptoms are not insults. They are information, and information, when met with knowledge and compassion, becomes power. I want you to leave this conversation feeling less afraid of what you see, less ashamed of what you do not know, and more connected to the wisdom of your own body. You deserve care that is gentle and clear. You deserve answers without humiliation. You deserve to ask direct questions and receive direct truth. And you deserve to stop carrying the quiet burden so many women have carried alone. So the next time you notice discharge and feel that familiar wave of worry, I want you to pause before fear takes over. Ask yourself what color it is, what it feels like, whether there is odor, itching, burning, pain, or a pattern that is new for you. Let observation replace panic. Let knowledge replace shame. And if something feels wrong, let courage bring you to care. Because there is strength in paying attention, there is dignity in seeking help, and there is absolutely nothing embarrassing about protecting your health. You are allowed to understand your body. You are allowed to trust what it tells you. You are allowed to speak about women's health without whispering, and you are never, ever alone in this. What your discharge is trying to tell you